Good afternoon, everybody. Today is today is Monday, December the 14th, 2020, and I want to be updating you on COVID-19. First of all, I want to be talking about the COVID-19 in Alberta and how important it is because everybody needs to know um, finally the vaccine is coming back and we have the vaccine now that's going to be coming this week and it will be distributed like I said. I heard that the vaccine it will be coming in Alberta on Wednesday, December the 16th, 2020. And that's just Wednesday that's coming. That day there will be a vaccine that will be coming in Alberta. So there is already vaccine. Vaccine already came Sunday night yesterday, and that's the Pfizer vaccine. And now we have it in Canada. Hopefully our numbers go down, including the government restrictions that they announced a couple of days ago, last Tuesday, when the government of Alberta announced new restrictions that will be restricted on Sunday night. So the government already announced it that last Tuesday, but it's very important that we have to do all we can at the end of the day to make sure that we protect ourselves and we care about our loved ones at the end of the day because that's what's really important for everybody to know. People need to understand that that's really important, especially in the time of COVID-19, especially the time that we are in a crisis like this. Hopefully, these numbers will go down. Hopefully, uh, uh, we get vaccine as soon as possible and make things life makes a life back to normal and everything goes back the way the normal it was. So hopefully we'll be getting closer to that. But again, it's very important that everybody does their part at the end of the day by protecting themselves, by protecting their loved ones, because if you don't care about your loved ones, it's a problem at the end of the day. And people need to do the right thing by doing physical distancing, by protecting their health as much as they can. They don't need to go out for unnecessary things. It's very simple. It's very understanding to make sure that you do your best as much as you can by protecting your health, by protecting your loved ones, and making sure that everybody else uh, doesn't get affected in a time of a crisis, in a time of pandemic. You have to do what you can, and that's what it is. Especially now, Christmas is coming, New Year's is coming. I urge everybody to do their best as much as they can by protecting their health and staying home. Although we have vaccine came to Alberta, that does not mean that everybody goes back and does what they want and does what they feel like. Because for us to go back to normal life, it will take at least a couple of months, not months, maybe years. Will take a couple of months, maybe until March or maybe until April. Maybe by then we're gonna see little improvement, and maybe by then uh, it will be very important that everybody can make sure that their health is at safety and making sure that at other people's health is safety at the end, right? Yes, we have good news now. Vaccines coming. We're all happy about that, but at the end of the day, we have to do our best by protecting our health. That's what's really important because numbers are high every day when we read the map and we read the chart. Numbers are really high every day when we hear it, right? So vaccine came, it will come on Wednesday. I will be updating again on Wednesday, December 16th, on new restrictions about COVID-19. And about no, will be on new restrictions about our school because our school I will be replacing a restrictions that will be in effect on Wednesday, December the 16th. I already said that last week, and I will announce when will school will open. Either it will be February 20th, 2021 or June 20th, 2021. So I did not make any decision. We will see how the vaccine goes in the next couple of months because they're just coming now, right? By January and February. I'll see how the vaccine is because if the vaccine no problem with it and a lot of people get cured and everything goes back to normal by that time, then we will be lifting the lockdown of the school by February. If I see still that still people are not cured and numbers are still going high and things are still out of chaos, then we're gonna have to open it in June. And if not June, then it's gonna be in the summer. Uh, but yeah, by us going back to life normal, it will take at least a month or two or a couple of months. It does not mean just because we get the vaccine this week, that does not mean that suddenly life is going to go normal. Everybody does what they want and everything is going to go the way it is. No, this will take process. This will take time. So we have to be patient. We have to be ready for it. and we have to do what we can at the end of the day, because everything takes time, everything takes process at the end of the day, and we can't just sit there and saying, okay, things are just going to go back to normal and everything is going to go the way it is. This is a process. This will take time. So everybody needs to understand that this this COVID came. It came harsh as we didn't expect it in March, and now for it to leave, it will take at least 2 3 months for it to leave, and we have to be patient and we have to be hopeful, right? Um, I know a lot of people they want to go out. A lot of people they want to go and spend time with their families this Christmas, this New Year's. But people have to be patient. People have to uh, think about this Christmas either with should I risk myself going out and make other people sick, or should I risk staying home and protecting my health for only for this Christmas, right? Or for only for this winter break, right? Because uh, things things are not gonna go normal this winter break, but we have to we have to see our health is more important than going out and being taking a risk and making other people get sick and not well. Because there's people out there that don't think that way. There's people out there that think their health is not that important and seeing their loved ones is more important. And I'm saying that's not right, because you get a COVID is out of the way, right? There's some people they're gonna argue with you now, tell you now because the vaccine came, I can just go back to what life normal and I can do whatever I want. No, this will take a couple of months, right? And even if you're gonna get the vaccine is not gonna come right away for the people who are young. It is a process here. The healthcare workers have to get it. If you're not working the healthcare field, you're not getting it. You're not gonna be the first person to get it. If you're not a person who's working in if you're not a senior, you're not going to be able to get it first. There's only the people who are in the senior people, and the people who are working the healthcare. Those are the people who are going to be getting the vaccine. Other than that, other people they're not going to be getting the vaccine. So vast majority of people they might not get the vaccine. So you have to know that the vaccine is going to go only for the people who are old and for only the people who are working the healthcare. It's going to go first on the long-term care homes. This is where the COVID high rates are rising in those long term care homes. So we have to do what we can as much as we can and protect our health. We should be happy now the vaccine came to Canada. So this is an improvement. That means we are super close to this COVID is almost ending. For we getting super close by beating this virus. But at the end of the day, we have to do what we can by protecting our health. That's what I encourage everybody to do, because still our numbers are really high in Alberta. That does not mean, and now there's new restrictions too. If everybody goes out and does whatever they want, there's going to be fines the government's going to be giving. So it's very important that you follow what the government did and follow the restrictions, right? And it's too late. Yes, Jason Kenney's government announcing restrictions in the last minute. I say it's really late, right? This restriction should be in place in November or even earlier in September. He had beforehand, he had in the summer to put the restrictions. But no, we have a stupid government that does not see health, people's health is not important. And this government didn't do anything for the time of the pandemic. They cut healthcare workers. They made us suffer during the time of the pandemic. The pandemic's almost done now, and the government didn't accomplish one thing. They cut healthcare workers. They made tons of people die in Alberta, right? The reason our numbers is this high now in Alberta is because of Jason Kenney's government, and that's what's causing these numbers to go high, and it's really devastating when you see these kind of numbers high every day. Every day we're getting 20,000 cases a day. If you see the Alberta table numbers, and that tells you because the government is not responsible, and we have a medical officer that's not doing her proper jobbing by not giving accurate numbers of Alberta. And I see even those numbers are false because maybe those numbers are higher than the numbers that we're getting every single day. And that's what our government does. The Jason Kenney's government every day is sinking, sinking, sinking because it's not accomplishing anything. This government, 0% are accomplishing anything. 0%. And that's how I see this government is just nothing but a failure at the end of the day. And definitely when we go to the next election, they will not win this election because they prove to the people that they don't care about them. They don't care about the people's health. It's not just Jason Kenny. Anybody who's rich and has businesses, it just thinks about his money and his belongings, and he doesn't care about other people. Because really, people who are rich and have money, you don't see the people who are poor are something to them. They see everybody should just deserve the way they deserve, and that's not right. Like rich people, they just think nothing about money, right? People's health is not doesn't matter, but their money is more important than people's health, and that's what Jason Kenney's government is. He thinks his businesses and he rather his businesses stay where it is rather than people's health. And he doesn't see people's health that important. Every day, people are dying like crazy in Alberta, and his numbers is like his businesses is more important and more suitable for him. And that's crazy. At the end of the day, that's not how things should work, right? Because imagine you losing a loved one or losing a family member or losing a friend. It's sad, but he doesn't have that feeling as a premier. He doesn't see it is important. He doesn't see what he's doing is wrong. And nobody is telling him. And it's just stupid to see a government that just doesn't care about people's health. That's why our numbers are suffering every single day in Alberta. And it is really disappointing when you see a government like that is not taking nothing seriously. Is huge. So that's why I'm saying people need to take their health seriously. I don't want people to listen to this government. This government is not is not showing an example. Government is supposed to be showing examples. They should show you what's the right thing for you to do. But this government is not showing the right example, it's showing the wrong direction. And that's what people are doing. People are not following the wrong direction. And some people are following the right direction, like the healthcare workers, like the people who are working staff, they're following the right direction. But and some people they're not wearing the mask, right? Uh, it's very important. There's people that are they don't accept mask, and I respect these people. But at the end of the day, uh, this mask is not for you for a joke not to wear it. You have to wear it because this is your health they're dealing with. This is your this is your health. At the end of the day, this health. People, a lot of people died because of this. So at the end, now the vaccine came. There's a lot of things we need to learn from this COVID. A lot of things we need to learn from it because this is a health crisis. This can happen again in another 10 centuries. Hopefully not. But we need to learn something from this COVID, right? This COVID, it came to us. It changed our life. It ruined our life in every couple of ways, right? And now we're gonna go back to life normal. But um, right? With this positive thing that came out of this COVID and these negative things that came out of this COVID, and we all know that, right? So at the end of the day, like when it came to schools, the diplomas in Alberta they were cancelled. For example, people don't have to write diplomas. That's positive thing because if there was no COVID, we would have been having diplomas now in schools. So that's one positive thing I can say about the COVID did. One negative thing, it changed our lives. We can't visit people. We can't do things the way we used to normal. We can't now. We have to wear masks. We can't breathe outside the normal oxygen that we used to breathe. So that's a lot of negative things that I can say about the COVID-19 what it did to us. So I'm saying we are gonna go back to our life normal, but people have to be patient at the end of the day. We have vaccine now finally came to Canada thanks to the federal government. At least the federal government did a lot of support during the time of pandemic, and I appreciate that. At least that government did something the time of the COVID, and that's a good example. It's not a government that does cuts during the time of pandemic. It's not a government that makes a lot of people die a day and so stubborn by not just doing a lockdown. We have a federal government that's taking things seriously, is not joking around in any of the matter, and that's a government that we need, especially in Alberta and in the rest of Canada. A government that's responsible, a government that cares about their own citizens. That's the government that we need. We don't need a government that just sits back, doesn't do anything, and doesn't see nothing's really important. So it's very important. I encourage everybody to do their best. Vaccines is on the way and it's coming in a day. It's not just not tomorrow, but on Wednesday it's gonna be arriving to Alberta. Until Wednesday, please, and only like I said, if you're only a healthcare worker or you are somebody who is working in if you're a senior or healthcare worker or any kind of person, those are the people who are going to be getting the vaccine first. There's not anybody getting the vaccine because the government already chose the people who are going to be getting the vaccine first. And everybody heard it about it. It's going to be first the healthcare workers, then it will be the seniors, and then it will be the vulnerable people, and it will be everybody else. So this is the process. There's a process to this vaccine too, right? There's when who will get it first, who will not get it first. So that's what it is, right? So that's why I'm saying I'm thinking by March or April, numbers should be getting really better in Alberta. Hopefully, numbers shouldn't be in the thousands. I'm hoping because it takes a couple of months for the vaccine to show that it's working, right? We can't see any results by January, right? Because the vaccine we just got it this week. So I'm saying by like maybe by March or by mid of March, we might see kind of results or might see kind of something that happens with the vaccine. But this will take time. Like I said, this needs patience. There's not something that people just get it and oh, life can go back to normal. We have the vaccine. Let's just go the way we want. No, this takes time because for life to go back to normal, there has to be tons of people getting the vaccine first, and then life, and that takes at least a month or two for that to happen. So we have to be patient until that happens, right? And we might even have to wear masks until June. By June, masks will be maybe gone, and life is slowly gone. But by the time we reach maybe March, maybe we're going to be able to go back outside, maybe we're going to be able to do things, even stores, everything is going to start opening. Now we have restrictions, right? But for us to have back to real normal life, it will be by maybe mid-March or even by April or May by that time. But until that time, things are just going to be the way it is now. So we have to do what we can at the end of the day by making sure we protect ourselves, by protecting our loved ones and everything. Because the vaccine came now, but that does not mean COVID is over, right? We still we battle it. We are fighting it every day, but uh, we have to know that we're not done with it yet. So we have to make sure when it's very safe to go outside, then we go outside. But you don't need to go outside now and harm yourself and get sick, right? You don't, right? There's already enough. Jason Kenney government is not doing nothing about it. We don't go and harm ourselves and make ourselves sick and not well. So we need to do what we can. Now I'll be updating you on COVID-19 in Alberta. So today I'm going to be reading the numbers in Canada first, and then I will be reading the Alberta numbers. So Canada has 46,006,715 cases. Also, before I read the numbers, I have if anybody wants to say anything in the chat and wants to type it in the chat, I will answer your questions according to the chat, right? So any questions you can answer them in the chat. Everybody needs to know that sometimes people have questions, right? And you want to answer it, right? So that's what it is. Now I'm going to be reading the Canada the total COVID cases numbers are really high still in Alberta and the rest of Canada. So just people to know that, right? So Canada has 46,006,715 cases. That's Canada, the whole country COVID cases. Alberta has 81,986 cases, 734 deaths. British Columbia has 40,797 cases, 598 deaths. Manitoba has 21,264 cases, 499 deaths. New Brunswick has 558 cases, 8 deaths. Newfoundland and Labrador has 359 cases, 4 deaths. Nova Scotia has 1,420 cases, 65 deaths. Ontario has 14,002,121 cases, 3,972 deaths. Prince Edward Island has 98 cases, 0 deaths. Quebec has 16,005,535 cases, 7,533 deaths. Saskatchewan has 12,238 cases, 91 deaths. Northwest Territories has 21 cases, 0 deaths. Nunavut has 256 cases, 0 deaths. Yukon has 58 cases and 1 death total. So those are the cases we have in provinces and territories. Now I'm going to be reading the daily deaths a day we have in the provinces and the territories. So Canada has 5,891 reported on Sunday. Alberta has 1,717 cases reported, no, 1,717 deaths reported on Sunday. BC has 0 deaths reported on Sunday. Manitoba has 273 deaths. New Brunswick has 2 deaths. Newfoundland and Labrador has 2 deaths. Nova Scotia has 6 deaths. Ontario has 1,677 deaths. PEI has 0 deaths. Quebec has 1,994 deaths. Saskatchewan has 222 deaths. Nunavut has 0 deaths. Um, Northwest Territory has 0 deaths, and Yukon has 0 deaths. Right, those are the death total that we have in Canada. Daily test total. So each day, how much death we get in each province. Alberta has 22 deaths total. BC has 0 deaths total. Manitoba has 0 deaths total. New Brunswick has 0 deaths total. Newfoundland and Labrador has 0 deaths total. Nova Scotia has 0 deaths total. Ontario has 16 deaths total. PEI has 0 deaths total. Quebec has 33 deaths total. Saskatchewan has 3 deaths total. Northwest Territory has 0 deaths total. Nunavut has 0 deaths total, and Yukon has 0 deaths total. So these are the cases that we have in Canada. Now I will be moving on talking about Alberta's cases and announcement that we just announced today. So we have announcement that came from Alberta today. So it's very important that it's very important. Now I'm going to be reading the Alberta's numbers, and then we need to know. So Calgary. So Calgary, the latest, everything you need to know about COVID-19 in Alberta on Monday, December 4. Alberta reported deadliest day of pandemic with 22 more deaths as new restrictions take effect. So the new restrictions, they took effect on Sunday night. Yesterday, there were new restrictions that took effect. So that's what I need to know, right? So the latest, Alberta reported 1,887 new cases on COVID-19 on Monday, a new record high, and another 15 deaths. Across the province, 716 people are being treated in the hospital for the illness, including 136 in the ICU beds. So these are so Alberta plans to administer first dose of COVID-19 vaccine of 29,000 healthcare workers by the end of December, the province's health minister said. Starting this week, 3,900 doses of the Pfizer BioNTech vaccine will go to ICU doctors and nurses, respiratory therapists, and long-term care workers in a bid to keep both the workers and those under their care safe. Details on the vaccine and Alberta plans to date can be found here. So, um, so I'm going to be reading the Alberta numbers, and now I'm going to be moving on talking about how the Alberta numbers are. Um, So here is the regional breakdown of active cases reported on Sunday. So Calgary zone has 7,286 and 68, up from 7,127 reported on Saturday, 24,042 recovered. Edmonton zone has 9,778, up from 9,548. 23,884 recovered. North Zone has 1,289, up from 1,236, 3,968 recovered. South Zone has 572, down from 589. 3,889 recovered. Central Zone has 1,589, up from 1,522. 200, 2,903 recovered. Unknown has 68, 6, up from 50. 132 recovered. So these are the COVID-19 vaccine, right? So Alberta plans to administer first dose of COVID-19 vaccine to 29,000 healthcare workers by the end of December, the province health minister says. So, so that's how much a lot of people, and there's gonna go first, like I said, the doctors, the ICU, and the people who are vulnerable here, right? So it's gonna go to certain people, and some people are going to um, have those kind of COVID numbers, right? And that's why it's very important that everybody does their best. There's a lot of people that are going to be vaccinated, including the doctors themselves. They're going to be vaccinated, right? So we will see what happens when the government when Wednesday comes, because already around from Wednesday all the way till Friday, that's how much people are going to be vaccinated for the coronavirus, and that's what's going to happen. So we will see what happens in the meantime. But in the meantime, like I talked about, it's very important that people do their best as much as they can by protecting their health and making sure that you take everything seriously as much as you can. Please don't joke around with your health, right? Vaccine is on the way on Wednesday, so really do your best. Is there any questions that anybody wants to be writing on the chat, or have any questions about the COVID or with the vaccine, or what's going to happen with the vaccine? Because if there's any questions, I'm willing to answer those questions in any way, right? If there's anybody who has any questions about the vaccine that's going to be coming this week, or what's going to be happening in Alberta, because we have to know that our health and our safety is really important, right? And we have to know how important it is and how much seriousness it is at the end of the day. Because some people, they don't know the seriousness of this COVID, but you need to know the seriousness as much as you can, right? And I'm willing to answer your questions. If you have any questions in the chat to write, I'm willing to answer it live now. If not, you can answer me anytime about the chat. But if you have any questions about the COVID, I'm willing to answer it as much as they can, right? So it's very important that everybody does their best as much as they can, and follow the health rules, and please uh, please do not joke around with your health as much as you can, because we have only one body in the end of the day, right? And we have to do what's right, because some people, they just don't care about their health, and you don't see their health as that important. And we have to see how important it is, right? How important our health is, how important our life is, because that's what really matters in the end of the day. Uh, is not about COVID or not COVID. Is what matters at the end of the day is our health. And some people, they see their health is not that important to them. It doesn't matter to them. So it's what you see at the end of the day. That's what. So that's so that's what everybody needs to know, how important it is at the end of the day, because because understanding and taking it very seriously is very important. And please follow the health rules, follow the health guidelines as much as you can, because at the end of the day, it does not matter what the health rule is or how much things are. Please follow the health rules, take it very seriously, and understand the concept of it, because some people, they just see it. It does not matter, right? So I'm going to be moving on now, talking about today's lesson, and how and what lessons that we're going to be talking about. So today's lesson, it will be about lesson one. I've also posted a quiz, so you guys have a quiz that you guys are going to be writing from my class. You guys have a quiz that you're going to be writing, so it's very important that you do that quiz and making sure that you do well in that quiz and you put your best effort as much as you can. So that quiz will be available as much as you can. So for my class, there's going to be a quiz, and that quiz will be due today. Is there any questions, or there's no question? Because I can be continuing reading more articles and more stuff about what the government says. But also on Wednesday, I will be updating you guys on the new restrictions that will be taking effect this Wednesday for my school, and for our school will be the school restrictions that will be taking effect this Wednesday. So it's very important that everybody understands that those restrictions will be in effect and it will be there. So it's very important that everybody understands that those restrictions are going to be school restrictions. That means with your cameras, everything. I'll be putting restrictions are when it comes to the class and it comes to everything. Plus, there will be. I'll also announce on Wednesday when will school open. Either it will be on February 20th, 2020. Like I said, I'll have to see first when the vaccine will be, how the vaccine will be going on from the rest of December and beginning of January, right? If Probably I will be announcing uh, uh, opening school maybe by March or maybe by end of March or sometime then, but it might not be happening now. It might not happen in the future, right? So I might have to wait that long to open schools, right? Because now we are online, and it's very important that we know that that's what's important at the end of the day. So it's very important that everybody does their best. Please follow the health rules, follow the guidelines, and that's what I encourage everybody to do because some people they just don't care about their health at the end of the day, and some people they just take their health as a joke, like it does not matter to them, right? Your health, you have to know that's what makes us live today. That's what makes us be around today, each day, right? People die like crazy every day. So hopefully this COVID that came today, came last March until now, we have it. Hopefully we'll learn something from it because everything there's a lesson to learn from, right? And this COVID should be one of the things we should learn from it. And if something like this happens in the future, so we should be more prepared for it and protect ourselves, right? Hopefully we're gonna go back to life normal. Hopefully we're gonna enjoy our hopefully people and hopefully like I said, this Christmas and this winter break and this New Year's is not gonna be the time to go gather and do COVID and hang out with each other. People need to wake up and realize that yes, vaccine came now, but still we're not end of this COVID. We need to do what we can and do what was possibility to protect ourselves but to protect our loved ones. That's what's really important. And that's what I encourage everybody to do because there's no coming back for it. There's people that die because of it every day, right? And if you're young and you have COVID, you have to wait until the doctors get it, until the nurses get it, until the healthcare workers get it, until the seniors get it. There's a long range for you to get it. So it's better for you to make sure, especially if you're young. I encourage you not to go out and not to do anything, but you're not going to be the first line to get the vaccine. Already, the government today announced already that the first people are going to be getting the vaccine are going to be the healthcare workers. So if you're not working in the healthcare field, you're not getting it in the beginning. But if you are in the healthcare field, then you are going to get the vaccine. So all it depends at the end of the day who gets it, who doesn't. And that all matters at the end of the day, right? So this kind of thing shouldn't be a joke. It shouldn't be a joking matter. It needs to be a serious matter and something that everybody needs to take it very seriously as much as they can, because there's no going back to this. There's no seriousness of this at the end. There's no going back to this, and people need to really wake up and realize the future and realize the reality and realize the important parts of this COVID as much as they can, right? Because this COVID comes and then leaves, and we have to do what we can at the end of the day. That's what's really important. So I encourage everybody to please this long winter break, please do what you can by protecting your health. Please do what you can by not making other people affected as much as you can. Please just follow the health rules. That's all I'm asking everybody to do, right? Anybody who's watching this YouTube, please, what I'm giving instructions on and video on is please follow the health rules, follow the health guidelines, and that's what's really important. Because if everybody does that, this COVID numbers are slowly going to go down. It's not just the vaccine, but other things are going to make it go down. But if we don't do what's right in the end of the day and we just do whatever we want, then this will take time and this will take very long time. So if you want to get covered through this COVID fast, we have to follow the health rules. We have to do what we can at the end of the day because that's what matters at the end of the day. People need to know how important it is, how things are, right? So please follow the health rules, follow the health guidelines, and that's what it is, right? The government already announced it today, so we need to do that, right? Tomorrow I will be also giving another COVID-19 update at uh, 2 2:10 the same time tomorrow. And then on Wednesday, I will be updating on COVID-19 new restrictions for our school and it will come to effect on Wednesday, December the 16th, 2020. So I will be giving new restrictions about our school, and it will be coming to effect on Wednesday, December the 16th. I'll announce that on Wednesday, and the restrictions will come also with it. So the restrictions and also when the school will be opening, that those and those day that day you guys can ask me any questions about the restrictions, or you can ask me any questions about the COVID. I'm willing to answer any questions about the COVID or about the vaccine or about how it's going to be distributed. If anybody wants me to repeat it again, how who's going to be getting the healthcare, who's going to be getting the things. So anybody, I'm willing to do that, right? But if you have questions, I'm willing to answer it because people's health is really important, and everybody's question should be answered, and that's what's really important, right? Um, if you have any questions, you can either type it in the chat or you can uh, verbally talk to me and answer me, right? So it's your choice. But um, so it's really important. Now, there's another person asked me a question about the COVID, right? About how the process works. I talked about the process already last Tuesday about how the process of the vaccine will be distributed. So the first of all, the vaccine will be distributed by going to the healthcare workers first, and then it will be going to the seniors, and then it will be going to everybody else that needs it. So this is a process, right? Like for it to came to Canada, it had to go to Britain. It came to Canada. America also got it, but America is going to get it later than Canada because of Donald Trump that he decided not to allow the vaccine to come to the U.S. So the vaccine's not going to come now to America. There will be some that are going to be coming to America, but not all of them because some of the shipments, the president is not even he's not even the president, but he uh, he 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 didn't allow those shipments to be going, and that's what happens, right? He's a loser of a guy, and really Biden, he's the real president there. He's not. He's the one who he's supposed to be in power, not him. He's not irresponsible, idiot, and at the same time, I just see him as a loser, right? I don't even want to talk about this president, this guy anymore, because he's not even in power anymore. He doesn't even matter anymore. But my point is their vaccine is going to be coming in the next couple of days or some time. It will take time for it to come by that time. But for us already, we got it before Canada came. Canada was one of the early countries to get the vaccine because of our prime minister signed up with the vaccine visor. He signed up with Moderna. He signed up with Oxford. He signed up with Johnson and Johnson. All these vaccines are going to be coming, but the number one vaccine now is Pfizer, and that's one it came this week, and ours will be coming on Wednesday, and that's when Alberta will be getting their vaccine, and they're going to start vaccinate people soon, right? On Wednesday, they said they're going to start vaccinating people, and they're going to start with the healthcare workers, and they're going to be doing that, right? But I'm just saying, for the country, until it becomes safe to go outside and travel and to do everything, this will take like at least a couple of months for life to go back to normal. I'm talking about Canada. I'm not talking, I don't know about the rest of the world, how things are going to be, but Canada, for life to go back to normal, it will take at least a couple of months. It's not going to be going back like the past, right? Because you need to have enough of a million people to have the vaccine for the nation to be well and good. So, and that will take time. So it's very important that until that time, like I said, uh, you do your best not to go out, not to go shopping, especially now there's restrictions now in stores, there's restrictions in shopping, there's restrictions in everything. So we need to do what we can at the end of the day by protecting our health and caring our loved ones because if we don't do that, it's going to be very late. So seriously, people need to wake up and realize now there's restrictions too. And if people don't want to listen to me, that's fine. But there's restrictions in place too. And the most important thing about the restrictions is for you to follow the government's orders. I know there might be people that out there are upset with Jason Kenney, and I'm one of these people that I am upset with Jason Kenney because I see him as a loser. I see him as a loser premier that he has the worst rating in Alberta that tells me worse disapproval rating. He didn't create jobs. He didn't do anything. He cut healthcare. He damaged the economy. He did everything terrible. And I hate him and I don't like this guy at all. But I'm saying that it's very late. Yes, I agree. But then some people they think that it's very late for him to do restrictions, and I agree with that too. I see he should have done those restrictions in September. He had summertime to do the restrictions, but he decided in a time of Christmas. These people are upset because their Christmas ruined. I understand some people. These people. I read articles that people are angry out there about their Christmas because they're going to be ruined because of this premiere, and I agree that our Christmas can be ruined because of him, right? Because really, our Christmas would have been going really well if he did the restrictions earlier, but he did not. He did in the time there's the time there's a break, there's a Christmas. He decided to do those restrictions that time. So it is really upsetting. Like I do agree with these people that say these things. And yeah, they have a point because at the end of the day, why should you create a restriction in the time of Christmas when you had a chance earlier before Christmas to do those restrictions? So that's why now people have to stay home. Some people are not happy with the government order, and I agree. But uh, again, for these people who are going to lose their Christmas, I'm just telling you that it's just this Christmas, right? Next Christmas, we're gonna go back to life normal. Everything is gonna go back to life normal. We just have to be patient, right? Sometimes we do things in life, it's not gonna work out, but we have to be patient because if we do not learn patience, nothing is gonna work without patience. Even for me, when I do things, I have to learn patience, and patience is the one number one thing. And there's a lot of people out there that do not have those patience. So, so I know our patience is very strong, and we have to be waiting, but we have to wait and get there. We are close getting back to the life that we want it to be, but we have to do what we can in the day, right? If we don't see our health is important, and this COVID, what I learned about it is I learned that my health is more important than anything because sometime before this COVID, my health didn't matter to me. I didn't see it's that important. But thanks to this COVID, what we learn from it, the first thing we should learn from this COVID is our health. Because people that die every day and we're thinking health is just a joke. But this COVID should make us wake up and realize that our health is a crisis and our health is important. By us wearing masks, by us wearing this some people even they don't like wearing masks. And I understand these people, but this is your health. This is your health, right? This mask, I agree. To some people, they can tell you this mask doesn't do anything. It doesn't solve it. It just closes oxygen. I agree. I hate wearing mask. I hate it. It's a terrible thing to wear. But the reason I wear this mask is because I care about my health. I see my health is more important. I will do anything to protect my health. That's what it is. That's what we should learn about this COVID. But there's some people they didn't learn nothing from this COVID because some people they want to go out, they want to do party, they want to do anything. Those people don't care about their health because if you care about your health, you will do everything you can for your health. And health, we have to know, is more important than anything. Health is what makes us work. Health is what makes us go to school. Health is what makes us alive every day. So if we don't have the health, it's too late.